A lot of the people that we work with that seem to benefit most from the program have had recurring problems with clinical depression. And really a lot of what we focus on in our treatment protocol is geared towards individuals with those types of problems. But we also have people that have other clinical difficulties related to bipolar disorder and various anxiety disorders. And there are elements of our protocol aimed at directly helping those types of clinical issues as well. Part of the difficulty with depression is that it does have genuine effects on people's ability to function, and things that they can normally do with a whole lot less effort become so much more difficult when they are depressed. So what they learn here is the importance of taking even what seem like routine tasks and breaking them down into more manageable components. A lot of times what we see as people come into the program is you know, they've been motivated enough to start treatment, and if they've been depressed for some time, there's a sense that I've got to make up for lost time. So at the outset, they may have goals like I need to go home and clean my house. I mean, things have really gotten out of hand. So what we try to work with them on is shifting the perspective that, you know, maybe identifying, is there one room at home, or even maybe within that one room where we could just start and just have that be the initial goal, maybe a couple of cabinets in the kitchen versus going home and cleaning out the whole house. So we work with that process over and over, breaking down goals into more manageable parts, which end up being more motivating. So there's that. There's also the notion of what we call guided activity. And the idea there is that we want to set up plans and goals, specific goals in advance, and then really try to follow through on that goal regardless of how they feel. Of course, when people are depressed, they don't tend to be motivated to do some of these things, and so we educate them around that that's to be expected. But it's the actual act of accomplishing some of these goals that has antidepressant effects. So I'd say those are really the two main goals that we work with over and over again and help people troubleshoot with to really try to help target their depression directly. We could generally say that behavioral activation is what we would call an outside-in approach to treating depression, where you're changing behavior first. You're not waiting for the feelings or the thoughts to change first before trying to engage in personally meaningful behavior. So that's sort of the outside-in philosophy. Cognitive therapy has more of an inside-out philosophy, where you're looking at trying to change beliefs that the patient has, trying to change cognitive distortions and irrational beliefs to more realistic beliefs, and the idea there is that may then help them feel differently and then act differently as a result. The way our sessions are set up, there is an educational component around coping skills. So we were just mentioning behavioral activation. They would be equipped with an understanding of the treatment rationale, understanding both their depression and then the idea behind why changing behavior first could be very helpful for their depression. So we have some focused psychoeducational components to the program, and then there's also a group therapy component where there's an opportunity to talk more at length about their own particular situation, get feedback from other members in the program, and then that's also an opportunity to do some focused goal setting, some specific goals that they can try to identify and follow through on a short-term basis, because they are coming in 3 days a week, so there's frequent opportunities for follow-up throughout the week on various goals that they set up. Most of the people that are in the program tend to stay somewhere between 2 to 4 weeks, so that's really when we see the most benefit that people have, and it's typically around that time that they're ready to transition back out of the program and continue working with other outpatient providers on a less intensive basis.